I'm an International Volunteer Association, and today I'm here at Health Builder Labs to meet with Dr. Xanya Sofra to introduce the signal therapy.
It's represented by two different devices. One is the Health Builder and the other one is the iElios. The Health Builder was built and invented in London University. In 1994 was the first device that came out of London University, and it was invented by the co-inventor of the pacemaker, who was commissioned by the Multiple Sclerosis Society to do a device that would be like a pacemaker for the motor nerve. Like the pacemaker replaces the signal of the pacemaker cells, this device was meant to replace the signal of the motor nerve. In later versions of the technology, we found that this device is the only device that can work on visceral fat, and that it works through the hormones to give you a full contraction that is similar to when you're exercising in the gym. This technology is quite different, and it's based on much newer research, primarily my research, on ion channels, and it involves very low proprietary energies at which it has been mathematically proven since 2008 that the ion channels of the cells open up and allow ions as well as signals, which is what our technology is all about, to enter the cells. Now, this technology started, the concept started in the year 2000. This device came out in 2011, and since then we have made a lot of research. So we're talking about almost 18 years of research that can bring us to the latest invention of this technology that is really unique in this world. Nobody else has it.
Yeah.
We are the only ones who have this technology.
So, Dr. Xanya, how does signal therapy work?
Well, it works through, these devices basically emit signals. The Health Builder emits the signal of the motor nerve. It goes to the motor nerve stimulates the motor nerves around it. The motor nerves around it eventually will reach the brain because they travel through the central nervous system. The brain will get into exercise mode. Because it gets into exercise mode, you will have the same hormonal release that you see during strenuous exercise. The most important thing about this technology is that you have a contraction that lasts from 4 to 6.5 seconds. That means that your grandmother can exercise at the rate of a professional football player that has spent his entire life in the gym. This is significant because the professional football player will take years and years and years in the gym to reach that level.
Yes.
And yet with this technology, boom, you get to that level immediately. This is why it works on visceral fat. This is why 1 month is like 1 year or a year and a half in the gym. The iElios is totally different technology. The Health Builder goes from top, bottom. It goes from the brain to the cells. Here you go from the cells to the entire system. So this technology has minuscule proprietary energies at which the ion channels of the cells open up, like doors and windows that would open up automatically, and would pass in signals that reinforce the signals that have deteriorated with age to reinstate it. So now you have sort of an age reversal process that happens with this technology that we have not seen with anything else in the world.
How about the signal therapy immune system?
Well, the immune system and aging, as you're aging, your immune system becomes less efficient, okay? So how? Because the signals of the T cells are deteriorating, other signals within the body are deteriorating, and you have sort of mismatched communications within the body. What this technology does, it does just that. It basically reinstates communications within the body. Now, there are additional uh, benefits with a health builder, for example. You detox your entire body. When your body is detoxified, this is what aging is. Aging is increased toxicity. So when your body is detoxified, of course your immune system is going to start working better. Now the other aspect is that it separates the red blood cells. We don't know why, but we have proved it experimentally, that it separates the red blood cells. Because it separates the red blood cells can carry antibodies much faster than it would be when the cells are all like traffic in Hong Kong at rush hour. So the cells are separate so they can carry oxygens and nutrients to the cell. That's enhanced health right there. And it also can carry the antibodies to the sites of action. So imagine somebody carrying a heart from here to the hospital in rush hour. Well, the patient will die. However, if there is no traffic, the separation of the red blood cells, then the heart will get to hospital time, the patient will survive. So it's a lot of great benefits. But the most important benefit is that both devices reinstate cellular communications. The health builder, in addition, increases hormonal balance because your hormones decline with age. So now, because of the secretion of hormones that are necessary, like when you say you go to the gym, you're going to be much healthier. Well, here we say you use the health builder, you're going to be much healthier. Why? Because you're going to get hormonal balance, you're going to get blood separation, and therefore you're going to get detoxification, and therefore your immune system will work better.
How does the signal therapy aid weight loss also?
Well, weight loss is easy because basically this particular technology, not this one, not the Aelios, but the health builder utilizes fat as an energy source to build muscle. And all the waveforms, he has about 12 waveforms, complex waveforms, that do that. And again, these waveforms are uniquely made by many, many waveforms, like a puzzle. Now, this is the only technology that reaches visceral fat because of the waveform, and because, remember I told you, you can have a contraction that lasts up to 4 to 6.5 seconds. This is not something you can sustain in a sit-up. And you do about 1,000 of those. You do 1,000 of these exercises. So that's how you can work on visceral fat. If you go to the gym when you're 65 years old, yes, you're going to build the muscle, but it's going to go above the visceral fat. This technology will help you to go all the way in. It works on visceral fat and, of course, on subcutaneous fat, which is much easier. And we have done experiments that have actually proved that with a significance levels of 1%.
So how about the anti-aging?
Anti-aging, again, we already discussed how the immune system is deteriorating as a result of aging, and how detoxification and hormonal balance will help that. But what this will do, primarily the Aelios, is will help communications within the cells. There has been a lot of research that has shown that when aging occurs, communications between cells are significantly diminished, and there is a lot of experimental laboratory evidence on that. So what we do, we revive these communications, and by reviving these communications, of course, you are prolonging that process a lot more. You're not going to go back to being 10 years old, but not yet. But you do prolong that process, so you stay younger much longer. And you also look younger. You look fresher, you look healthier. And that is the most important thing.
When are the long-term benefits of the signal protocol?
Well, again, it has to do with cellular communications being reinstated, and also with hormonal balance being reinstated. But we have seen, for example, we have seen burns, that third-degree burns that heal very fast. We have seen car accidents of wounds. We've seen diabetic wounds that are healing very fast. There is a recent study by Dr. Lambert that is doing on diabetic patients on pain and on mobility, and 100% of her sample has improved after the Aelios therapy. So it's the reinstating the communications, again, the body can start healing itself. You see, we are always underestimating the wisdom of the body. What we do is we get the body back to its feet to do what it's supposed to be doing to heal itself. So basically, we also have seen pain relief, quite substantially, yes. Mobility increase, wounds, pigmentations, a lot of different benefits.
Dr. Xanya, what can the protocol do to the skin?
Well, the skin basically, as you're aging, your skin loses the collagen, elastin, and actin, and myosin, so it starts sagging. So, but what it loses is not collagen. It's not that you need more collagen as you're aging. You need the signals that produce the collagen. So what this device does, it provides the skin with the signaling communications and reinstates the signaling pathways that will reinstate that younger, fresher look that is natural.
Oh, really?
And that's natural, yeah, because nothing else, everything else, you know, people look younger. Well, actually, they look without wrinkles, but you still know their age. Here, you don't know their age, you see, and that is the important thing. They're fresher, they look younger, and naturally younger.
May I ask you one embarrassed question? How old are you? And
I'm 65 years old.
Well,
Incredible.
yeah, incredible. So, what are the examples of the signal portable on skin rejuvenation?
Well, there's different programs, and you basically combine them, and you combine them like sequences of different signals that appear and disappear at different timings. And timing is very, very important because it's like performing a dance, pretty much, that you have to match it with what the cells are doing. So the dance of the ileus and the dance of the cells have to match. They have to dance together. And after they dance together, there is this effect of reinstating the kind of cellular communications. It's a very interesting, very intriguing technology.
I'm so glad to thank you about
Pleasure
this
meeting you.
Dr.
Pleasure
Xanya.
meeting you.
Yeah, we really
Thank you
appreciate your coming
thank you for
to
inviting me.
introduce this machine to us.
Oh, you're very welcome. Thank you for
Yeah.
having me.
Welcome.